Harvard Divinity School.
Psychedelic Consent, an Interdisciplinary Conversation, November 14th, 2024.
Hello, everyone. Welcome to our penultimate Psychedelics and Ethics event for the fall 2024 semester. My name is Jeffrey Breaux, and I'm a program lead for Psychedelics and Spirituality here at the Center for the Study of World Religions. The Psychedelics and Ethics series is now in its second year, and it is an important node in the larger psychedelics and spirituality research happening at the center. And this Psychedelics and Spirituality program is itself embedded in the center's larger, ongoing, and evolving initiative called Transcendence and Transformation, or TNT for short. I do want to let you know about the final psychedelics event for the semester, which will be happening on December 10th. That will be with visiting scholar Christina Hauskeller and an interdisciplinary group from her Decolonial Lens on Psychedelic Ethics workshop. The group during that event will discuss insights from the semester-long workshop and will explore ways that a decolonial ethic might advance psychedelic studies. You can register for that event, which will be both on Zoom and in person on the center's website. Registration is open and available. We'll put a link to that also in the chat. For today's conversation, we are joined by Kylea Taylor, Eddie Jacobs, and Emma Knighton, each of whom have unique expertise and insights into the at times thorny issues surrounding consent and psychedelics. To give a sense for how today's conversation will unfold, in a moment I will turn the floor over to my friend and colleague Paul Gillis-Smith, who will introduce himself and Kylea Taylor. We will then, Paul and I, will both disappear, and Kylea will take center screen for about 15 minutes to discuss her work. I will then appear to introduce Eddie Jacobs, who will speak for 15 minutes. And finally, we will introduce Emma Knighton, who will again speak for 15 minutes. At the end of these presentations, we will all return to center screen, and a panel discussion and audience Q&A will take the remainder of our time, about 45 minutes. With that, I will pass things over to Paul to introduce himself and Kylea Taylor.
Thank you, Jeffrey. Hello, everyone. I'm Paul Gillis-Smith, also a program lead for Psychedelics and Spirituality at the Center. Without further ado, I'll introduce our first speaker today. Kylea Taylor is a therapist and the developer and teacher of Inner Ethics, a self-compassionate, self-reflective approach to relational ethics, offering tools for professionals to provide optimal conditions for clients experiencing extraordinary states of consciousness, supporting protection, autonomy, healing, and expansion. Taylor studied with Stanislav Grof and Christina Grof in 1984 and worked as a senior trainer in Grof transpersonal training through the 1990s. She's the author of The Ethics of Caring, Finding Right Relationship with Clients from 2017, several books about holotropic breathwork, and peer consultation groups and ethical awareness tools for psychedelic practitioners, which has just been released late this year. And I'll send a link in the chat on where you can find that book, but it is available wherever fine books are sold. Kylea, the floor is yours.
Oh, thank you, Paul. I'm going to say hi, everyone, and share my screen so I can share with you what I have been thinking about. So as Paul said, in the early 90s, I was working as a trainer with Dr. Stanislav Grof and Tav Sparks in the Grof transpersonal training, which was the first comprehensive, very good training for facilitators of extraordinary states of consciousness, and still is, still going strong. I was noticing, though, just a few trainees, but they were a puzzling few, that were getting into ethical trouble and causing harm to clients when they started facilitating sessions in extraordinary states. It was puzzling to me because they seemed to be well-meaning therapists who had had the traditional ethics trainings to be licensed and who had not had any big ethical issues in their practices before. So I started to think that this must have something to do with the differences between working with clients in ordinary states of consciousness versus working with clients in extraordinary states. Expanded states and the long hours that we spend in these states create a palpable energetic field that affects whoever is in the room. Both clients and practitioners working in these states can experience greatly increased vulnerability and also increased suggestibility and sensitivity and emotionality. Traditional ethics education provides therapists with a list of do's and don'ts. Mostly don'ts. But the don'ts are important. They have been put into ethics codes by the collective because we have learned the hard way that these behaviors are harmful. But there just has not been much attention paid yet to how and why those behaviors happen. Not enough attention to what motivations are present in the practitioner before the harm is enacted, and while the harm could still be presented. Traditional ethics education has not included much of anything in the way of training in self-inquiry and relational reflection. Traditional ethics education, it seems to me, has been missing attending sufficiently to what I call right relationship with clients. And that is attunement and empathy and compassion and presence. In that preparation phase for a psychedelic session, the client is considering giving their consent to enter a vulnerable state in which they don't know what is going to happen. Traditional consent practices involve assessing the client's capacity to give consent, and then describing the procedure and informing the client about risks and benefits, and answering questions. These steps all still pertain to obtaining consent for psychedelic sessions, but psychedelic experiences are different from other procedures that involve consent. I want to highlight 3 big ways in which consent is different when working with psychedelics. These differences require more mindfulness. Mindfulness on the part of the practitioner, for sure, because they are the responsible party, but also on the part of the client. The most obvious difference is that it's hard to describe the experience of an extraordinary state to someone who hasn't experienced it before. If a person has never seen the color blue, for example, how is it possible to describe to them the experience of seeing that color? The second difference is that consenting to a psychedelic session is not only consenting to something you can't quite imagine or predict during the session, but it's also consenting to the possibility that you may be different afterwards in surprising, sometimes profound ways. For example, there's frequently an expansion, or what I call a personal paradigm shift, which is a shift in our perception of the world, or a significant shift in our relationship to ourselves after a psychedelic session. Michael Pollan titled his popular book about psychedelic exploration, How to Change Your Mind. So change with a capital C is something that often happens. A third way consent is different is that everything is amplified for both the client and the practitioner in a psychedelic session. There's greater vulnerability that requires commensurately more empathy and compassion and self-compassion. There's increased suggestibility, so that might indicate a need for less words and less intrusion from external input or distraction. There's more sensitivity. For example, the client may be able to pick up thoughts and feelings more easily from the others who are in the room. And there's often intensified emotionality and expression. Extraordinary states tend to increase the volume on feelings and reactions. And for all of this, there's an extended period of time in which all this amplification is experienced. In preparing for this panel, I wanted to think freshly about what consent is and what it is not, and if we might not be giving enough attention in our psychedelic field to some factor when we are considering consent. So I asked myself first, what is my definition of consent? The answer that came to me was consent is wholehearted agreement and permission. And this means to me that a person doesn't have any parts like IFS parts or internal family system personality parts that are in disagreement or conflict or in a state of unreadiness or unwillingness, because maybe these internal parts haven't been heard sufficiently and they haven't been reconciled yet to giving consent. There might normally be some anxiety, but the person understands that fear of the unknown is usually involved, and overall they're feeling willing and ready for a psychedelic session when they give consent. So another question was, how does a person know when they are wholehearted about anything internally? Well, people are different. Sometimes they feel an embodied no or a yes in their physical body, even if they don't know why yet. And sometimes there's a nagging feeling that they don't have enough information yet. And sometimes they just need more time. They need to sleep on it and dream on it and get references, consult their inner parts, or talk to a therapist. So honoring one's hesitations are important. A practitioner can give a client permission so that they can take their time. On the other hand, I think a practitioner trying to persuade someone to do a psychedelic session is definitely contraindicated. Here's another question. How does a person seeking wholehearted consent from someone else know when they have that full consent? For example, if the practitioner has verbal or written consent from the client, how do they know that the consent is wholehearted? How does the practitioner know that? Well, they don't know for certain, but the practitioner can ask the client and explore further. For example, the practitioner can say, it's normal to have some hesitation about doing a psychedelic session. Is there any part of you that has some hesitation about doing this? And then, if so, can you tell me more about that? And even if not asked, it would be great if the client would tell the practitioner to make sure they do know. The last question I asked myself at this point was, what is involved with wholehearted agreement and permission? What are the duties of the practitioners to provide those conditions? And I guess the next slide answers it. So the first word that came to me about what was involved in wholehearted consent was trust. And this is what I think we don't talk about enough in the psychedelic field. When practitioners are seeking consent from clients for a psychedelic session, they are actually asking clients to trust them to do their job. So what is a psychedelic practitioner's job? I am thinking these days that there are two main responsibilities that a psychedelic practitioner has. And of course, there are many responsibilities under these main two, but these are the two main categories. The first is to protect the client. Practitioners protect the client in so many ways in their vulnerable state. The second is to serve the client's best interests. So practitioners have to know themselves pretty well to be able to recognize a conflict between their own interests and a client's best interests. And then to be able to make choices, to choose the action or inaction that serves those best interests of the client. Clients are probably evaluating their practitioners constantly, and they are giving or withholding trust, starting with their very first contact with the practitioner all the way throughout the sessions. They are consciously or unconsciously evaluating if they trust this person to care for their vulnerability and to be compassionate with them. They're noticing if the practitioner has prepared well for their session. Ultimately, they're deciding if they trust the person's ability to attune to their needs and to have their back as they journey into the unknown. If trust is so important a foundation to consent, I wondered, how can a client and a practitioner build a mutually trusting relationship? How is trust created? In ordinary therapy, therapists and clients usually have a more leisurely series of sessions to build a trusting relationship. The irony is that with psychedelic sessions, a lot more trust is needed. There's increased client vulnerability. But often, these days in the psychedelic field, there's only 1 or 2 sessions to establish the level of trust that is ideal. So, ironically, that means that the client and the practitioner have to create more trust more quickly. But they need to do that paradoxically in a slowed down, caring, attentive way with a lot of presence on board. Most of the qualities on this slide would help the parties in any relationship to deepen trust, but with increased vulnerability, the presence of these capabilities becomes more essential. I'll just read down the list of qualities in case anyone is listening to this panel without benefit of screen. Being authentic and honest, being compassionate, trusting the process, preparing to give and receive information, keeping agreements, asking about whatever you're wondering, and not being attached to outcome. In the exchange of information in a preparation for a psychedelic session, it's important for both parties to speak honestly. After the checklists of all the questions have been asked and answered by each person, and before consent is requested, there are 2 wonderful additional questions that both the client and the practitioner could ask each other. The first is there anything else that you would like to ask me? The second question is there anything else you might think is important for me to know about you? So I'm going to stop here. I'm really looking forward to hearing from Eddie and Emma and their perspectives and ideas and thoughts about this subject, and to hearing your comments and questions after their presentations. Thank you very much for your attention.
Thank you so much, Kylea. I am now going to introduce Eddie Jacobs, who will present on his work. Eddie Jacobs is a Doctor of Philosophy student at the University of Oxford's Department of Psychiatry, where he is undertaking Wellcome Trust-funded research on the bioethical dimensions of psychedelic-assisted psychotherapy. Hard to say that 5 times fast. Eddie has led the drafting and development of the Hopkins-Oxford Psychedelic Ethics Consensus Statement, also known as the HOPE Consensus Statement, which was published in Neuroethics and the American Journal of Bioethics. He previously worked at the Beckley Foundation, supporting its psychedelic science and policy programs, and his collaborations with drug science include leading research into public attitudes on psilocybin and contributing to its Medical Psychedelics Ethics Consortium. Without further ado, Eddie, the floor is yours.
Thanks, Jeff. I clocked this talk at a little over 15 minutes, so do forgive me if it's delivered with a certain urgency and pace in respect of Emma's time. Today, I want to explore something that's perhaps like more of a philosophical irritant, a puzzle about informed consent in psychedelic therapy, rather than it is a practical objection. And I'll start by giving you the potentially controversial conclusion first, and then I'll see if I can convince you if it has any merit. The controversial conclusion is that informed consent for psychedelic therapy isn't possible, although I think that's actually okay. And I think this claim is true when approached from two angles. The first being, like, what do we think informed consent is? Like, what constitutes informed consent? And also, what do we want informed consent to do? Because at the end of the day, informed consent is a tool with a particular set of functions, and it may be that that tool isn't necessarily the right one for all contexts. I think a common sentiment after a first big psychedelic experience, where there's this profound gap between any explanation or description you might have been given beforehand and then what it's actually like. We don't need to get hung up on whether it's truly ineffable, as is in common parlance in the field, but I want to kind of draw this sentiment out a bit, like flesh it out, so we can explore it a bit. But I'm going to do that first, not by talking about psychedelics, but by talking about babies for a couple of slides. And so when I started thinking about this sentiment about the challenge of getting informed consent for psychedelic therapy, I was rooting around for a framework to make sense of this. And it came from a line of philosophical thought by L.A. Poole, who wrote about it in 2013, first of all, and later on this book, Transformative Experience, which is very well written, interesting to read, and importantly short, to give you a pitch on that. So Paul speaks about the decision to have children, which I think people will agree is serious, it's life-altering, and it's not really a decision that you should make cavalierly. But Paul argues that for some of life's biggest decisions, including whether or not to become a parent, you can't make it rationally, which is not to say that any such decisions are irrational, contrary to reason, but rather that they are irrational, operating outside of reason. There are different ways to formulate what it is to make a rational choice, but it's something like, well, we determine the possible outcomes from our choices, consider the costs and benefits associated with each of those, we'll assign each of these outcomes probabilities, and then we'll try and calculate which choice maximizes the benefits, minimizes the harms, and think about which one's going to give us the highest expected value. And prima facie, that seems like a good way to decide whether you want to have a child, because of course there are lots of benefits, but also costs, drawbacks, opportunity costs. But Paul takes issue with the idea of making a choice rationally in this scenario, because having a child is what she calls a transformative experience. And the clue is very much in the name there. Like, a transformative experience is an experience that's liable to transform you. And she uses this term in two ways. These experiences are going to be epistemically transformative, like, i.e., you can only understand what that experience is like by undergoing it. So no amount of changing your niece or nephew's diapers is going to clue you into what it's really like to be a parent. And moreover, you don't know what your potential future child is going to be like. And that makes a big difference to how you find being a parent. And more importantly, having a child is personally transformative. It's one of those experiences that is liable to change you in deep, perhaps fundamental ways, like your life priorities change, your outlook changes, your values can shift. And I'll quote from Paul here. The edifice of our choice model stands on shifting sands. In virtue of having the transformative experience we've chosen, we change what we care about. It means that if you choose to have the experience, it will change who you are. This affects the way we understand how the decision turns out. So for transformative choices, we only learn what we need to know to rationally decide after we've done it, and we change ourselves in the process of doing it. So to my mind, and Paul's mind, these features really gum up the machinery of what rational decision-making is supposed to look like. Like, you can't assign values when you don't know what it's going to be like. And more importantly, even if you could, transformative experience is liable to change what your values are. You're probably one step ahead of me at this point, but I think psychedelic experiences, certainly with high-dose psychedelics, the kinds you get in clinical trials, say, are transformative. They're epistemically transformative. Like, you can't imagine what it will be like except for going through it. I won't hammer this point too hard, but I'm just going to suggestively nod at these pictures. So I'm not making any special claim about these particular images. Really, I just picked them because they're very popular, and I think you'll recognize at least one of them. I won't get bogged down in any of the misconceptions or misuses of these pictures, but what they're all pointing to is something that no one's really debating, which is that take a high-dose psychedelic for the first time, and the way you process information is being radically disrupted by psychedelics, which is why you can't really adequately describe what it's going to be like beforehand. But psychedelic experiences are also personally transformative in Paul's sense, such that the act of going through it changes your perspectives, priorities, or values. And psychedelic therapy really can cause enduring shifts to priorities, personality. I won't go through everything on this slide here. And it's an open empirical question about the prevalence of these shifts, including in clinical settings. And perhaps we can discuss that if it's of interest later. But it's something that does happen, and it does happen in clinical contexts. Psychedelic experiences aren't always transformative in these ways. And I think it's important to note they're not always seen or felt as positive transformations. A fairly old meta-analysis, it's going on 15 years old now, of the early European psilocybin trials, found that for every 4 people who announced afterwards that they had a positively evaluated change to their relationships or to their values, there was 1 person for whom, yeah, they felt that they were transformed, but in a negative way. So I'll tell you why I think this is a challenge for informed consent. Some people have batted away this line of reasoning and this reservation by pointing out that we accept people's consent for all sorts of transformative experience. Getting married, having kids, joining the army or navy or what have you. And yeah, you can only understand these experiences properly by going through them. They're all liable to change how you see the world, yourself, your priorities. But in biomedicine, we set our threshold for consent that little bit higher. We ask for informed consent. And that threshold is higher because of the asymmetries in power, the asymmetries in information between patients and doctors. And a lot of ink has been spilled over this, and academics are very rarely in consensus about anything. But by far, the most prominent analysis of what it is that is needed for informed consent is based on these 5 features. Patients need to have the capacity to understand what they're being told, make a reasoned decision about it. Your clinician needs to give you the relevant information about what the procedure involves, whether there are any alternatives. And it's not just enough to disclose this information. The patient needs to understand it and its implications too. Consent, obviously explicit agreement, and of course, it needs to be voluntary, no coercion, no influence, no manipulation. And I think when you look at this framework for understanding informed consent, transformative medical treatments like psychedelic therapy, but by no means psychedelic therapy alone, comes up against some trouble. I made my case in a paper last year that transformative experiences are a problem for understanding. You can only understand the psychedelic experience and its significance by going through it, but also capacity is probably under threat too, which isn't to imply that prospective patients have diminished capacity as you get with children or people in the midst of, say, a psychotic break. it's more that transformative experiences, transformative medical interventions, like undermine this basic rational calculus, like it's the gumming up of the machinery, the unstable sands, which Laurie Paul wrote about. But to put it another way, let's think about what we want informed consent to do in medicine. So firstly, like we want to make sure that patients aren't coerced into doing anything they don't want. It protects physicians, clinicians from lawsuits, because without informed consent, surgery is actually a battery or an assault of some sort. But clinicians also, because they are on the higher side of this information and understanding asymmetry, they're expected to help patients decide what the best course of action for them is. We want patients to choose the treatment that's right for them, something that's sensitive to the values and preferences that the patient has. The medically best treatment isn't always best for a particular patient because people value different dimensions of life differently. I imagine everyone's familiar with prohibition for Jehovah's Witnesses for blood transfusions. If someone is really earnestly wanting to have kids in their future and the medically best treatment involves potentially compromising fertility, it would be perfectly rational for them to choose something that's maybe less effective. Anyway, so this process, like the weighing of possible outcomes, their uncertainties, how they relate to a patient's values, it's rational in character. That's what reasoning through your options is. And sure, you don't really know what the outcome of any medical choice is going to be. In life, you don't know what the outcome of any choice is going to be. Choosing under uncertainty is part of what living an autonomous life is. But for typical medical procedures, you at least know like the character, the severity, and the likelihood of outcomes. And knowing that information, you kind of place your best bet. To use a British colloquialism, like you pays your money, you takes your choice. It's kind of like rolling the dice. But when you roll the dice, actually, you know a lot of information because you know what's on each face of the dice and what's the likelihood of other actions, what's the likelihood of various outcomes. But this reasoning, as I've suggested before, is doubly frustrated for transformative medical interventions. The what is it like is epistemically inaccessible, like the psychedelic experience in its bizarreness, in its alleged ineffability. It's difficult to assign a value to what that's going to be, but also what it's going to be like for you is a challenging question to think about because you are liable to change. Like you can't decide if something is right for you if the you in question might not be the same in important ways after the intervention. So I think for these sorts of treatments, rather than rolling the dice where we have a good sense of what the possible outcomes are, I think the best metaphor is more like taking a leap of faith. Some people think this is nonsense and I'm going down the wrong route. A friend and colleague of mine, Dan Villager, kind of suggests, well, if doctors can't secure informed consent, they shouldn't be providing psychedelic therapy. So he says in the writing, in this passage, presumably, which I'm not a great philosopher, but I've been trained to know if a philosopher ever writes presumably, that's where you pay attention to. Because I think that the format of this argument is, well, if you can't get informed consent for a treatment, you should not perform that treatment. And I don't think that reasoning necessarily holds because sometimes in medical settings, well, firstly, there's going to be a transformative experience, whatever happens. Like in some contexts of complications in pregnancy, pediatric neurosurgery, the options available, the outcomes available are either you have a profoundly disabled child at the end of this, or you have a dead child, both of which are transformative. But in perhaps more standard medicine, there are plenty of times when we don't get informed consent. So in pediatric medicine, there's not very much that a 4-year-old can give informed consent to. In emergency medicine, there's not very much that an unconscious patient who is rapidly bleeding out can give informed consent to. Like, we have proxy consent in pediatric contexts, we have implied consent in emergency contexts. They fill the role of informed consent when we can't get it, but it's not informed consent. Yeah, I think if you can get informed consent and you don't, that's a problem. But maybe not so much if it's just impossible to get informed consent. Informed consent is a central plank of medical ethics, and for good reason. Like, it's a very good tool for protecting things that we care about. But it's not manna from heaven. Like, informed consent is a tool that arose at a specific, like, historically contingent point in time to meet the needs of the day, like safeguarding autonomy, like protecting patients in this context of an asymmetrical relationship. But for transformative experiences, like, rational evaluation is structurally impossible because the transformation might alter the very framework by which you make a rational evaluation. I think it's also important to acknowledge that if I'm effectively saying informed consent is not possible for psychedelic therapy, but that doesn't mean it's a free ride to do whatever we want. If a clinician is misrepresenting what's going to go on there, if they violate the boundaries of the patient, that's obviously not okay. Like, what I'm thinking about here doesn't really touch on some of these pragmatic matters. So I guess, what's the payoff for what I've argued about here? Like, what should we be doing if you do accept what I'm saying here and informed consent isn't possible? Well, I don't think how clinicians, research therapists have been going about their business is grievously wrong here. But I think it's important to underline to patients, when we're discussing psychedelic therapy as an option with them, that we don't describe what we're doing as informed consent. And I think that's as important for practitioners and researchers to recognize as it is for patients. I expect lots of people in the audience will know the stream of literature from Johns Hopkins that would suggest that, we should maybe tell patients that this may be one of the most spiritually significant or personally meaningful experiences of their lives. And that's not always a positive experience. In my thinking about psychedelics, I'm very frequently going back to a paper by Tassin Noorani, who was an anthropologist working at Hopkins. So he interviewed participants in the first tobacco addiction trial. And so these are people that had multiple quit attempts, had been trying to quit smoking for 10 years. They joined this experimental trial because they're so motivated to quit tobacco, to quit smoking. And after the fact, many of them shared with Tassin that quitting smoking was actually the least important effect when they think about the changes to their relationships, their worldview, etc. So I think what's really important here is to underline, when a prospective patient is considering going through this treatment, that it's different, like that there really is a leap of faith aspect to this in a way that's distinct from typical medical treatments. So Sasha Fink, who's a philosopher at Nuremberg, suggests we need to alter the social script into something that's more agentive, something that's more autonomous, like not seeking patients' consent to do something, but to wait and tilt the encounter onto the prospective patient actively requesting this treatment once they've had the options explained to them, including the option to do nothing, and then allow them to reflect on whether they want to take this leap of faith and get them to ask for this. All right, Finn.
Thanks so much, Eddie. Let's see. Next here we have Emma Knighton. Emma Knighton, who uses they and she pronouns, is a white, queer, able-bodied femme with a lineage rooted in Celtic druidry. Emma is a somatic trauma therapist, a psychedelic-assisted therapist, a psychedelic educator, an organizer, and a leader who focuses on increasing ethics, trauma-informed care culture, and pro-liberation practices in psychedelic facilitation. Working at the intersection of trauma and psychedelic healing and queer identity development, she's the director of services at Inner Trek, a psilocybin service center in Portland, Oregon. And they teach around the world about consent and trauma-informed care practices and psychedelic services, co-founded the American Psychedelic Practitioners Association, and were director of education at the Alma Institute. Emma is also a study therapist for MDMA group therapy for a PTSD trial at the Portland VA. Emma, the floor is yours.
Thank you, Paul. Hello, everyone. Good to see you on here. And I am going to take a moment to share my screen. So thank you, Kylea and Eddie, for your wonderful presentations. I'm noticing this like really beautiful flow between the three of us. My talk today is more about the how and really wanting to offer some concrete examples of how we do consent in psychedelics. So I'm going to talk about a body of work that I have developed and that I steward in the world and that I teach at many psychedelic facilitator training programs. And I call this trauma-attuned consent. So a couple definitions here. This body of work is really created with the goal of creating a safe enough container to do this work in, this work being psychedelic-assisted therapy, psychedelic facilitation. And I want to just hang out on these words safe enough for a moment. And something that I think that Eddie did a really wonderful job highlighting is that we can't ever know what is going to happen in these experiences. So someone can't say, I exactly know what's going to come out of this. I know who I'm going to be on the other side of this. And I know exactly what's going to happen during it between myself and my facilitator. And because of those things, and also just because of the society, culture, world that we live in, I personally don't believe that safe, period, exists for anybody. And so in this work, I'm offering this idea that we want to look for safe enough to do the thing. So in this case, it's safe enough to do a psychedelic session in the setting that we're in, with the medicine that we're working with, and with the people that are present. And so maybe you notice that this is very situation dependent and that this changes over time, which is a very strong hallmark of consent. Consent is an alive process. It changes moment to moment. And this is why I've really termed the body of work that I've created as trauma-attuned consent instead of trauma-informed consent, which is what I initially started with, just coming from trauma-informed care. But the word attunement, I think, highlights better what's really needed for the consent process when we're working with psychedelics. Being attuned to someone else, being attuned to ourselves, being attuned to a space is something that is embodied and it's alive and it's moment to moment. Right? When we're informed about something, it's kind of like, oh, okay, I know these things. I read this. We had this conversation about your trauma and I know it. I'm informed. Attuning to trauma is the process of saying what's happening in my body right now, what's happening in your body, and what's happening in the space between the two of us. And how is all of that representative of the moment that you're in emotionally, of the identities that we hold in the space, of the situation systemically, culturally, the familial pieces that are coming in, ancestors, the medicine that we're working with. There's all these different factors that create the container. And so I think that our job as psychedelic facilitators, I think it's our job to be a safe enough person to work with and to be able to attune to all these factors and how they arise in the relational container between facilitator and client. And that the consent process is about building a safe enough container for us to go into this vulnerable state in. So in the process of creating a trauma-attuned consent agreement, what we do is we co-create this living agreement. And again, it's this embodied thing. So we have to be in our bodies. We have to have access enough to our bodies in order to engage with our participants in this way, with our clients. And it's something that is different person to person, right? So that sense of co-creation of that every client that I have worked with, our consent agreements are a little different because they are all different and it needs to be attuned to who they are in the moment. And we center these agreements on negotiation, and that negotiation is based on desires. So what do we want? Our limits, what are our boundaries, and the risks that are present. So the limits, we're going to go into a little bit more of what boundary conversation looks like, but just know that the facilitator gets to have limits, the client gets to have limits, and those are balanced with what do we want from this process? And how can we create a space where everyone's boundaries are being respected? And part of this negotiation process is saying, can we find a place to meet where the needs are being met and the boundaries are being respected at the same time? So then this piece of risk. I'm going to talk a little bit more about risk in a moment, but what I want to invite in here is that this is connected to the safe enough idea of that doing psychedelic work is inherently risky. I think it is, at least, which means that we can never know exactly what's going to happen. There is risk going into this process. And so creating consent is about, can we consent to the risk that is present in the unknown that we're moving into? Can we consent to the risk of the unknown? And we have to feel safe enough in the relational space and in the setting in order to make consent, to say, yes, I consent to this thing that is risky, and here's all the potential risks, and I have no clue how this is going to go, but I feel safe enough with this person to take that leap that Eddie was talking about. Additionally, this body of work that I steward this is how we grapple with the reality that we're all capable of harming each other. And we all have stories of being harmed living in our bodies. And those stories are our personal stories and also our ancestor stories. And that applies to those of us that are facilitating and those of us that are in the client seat. And just like Kylea talked about, and I think that Kylea's work does a wonderful job of inviting people into that self-reflection of asking, where is your shadow side? Where are your hooks as a facilitator? Where are the places where you could get pulled out of alignment? And again, this invitation into a broader consent container outside of the kind of typical medical informed consent really invites us as facilitators to get radically honest with ourselves about what can we offer that moves towards safe enough and what can we not. And then there's that responsibility again of that it's on us to be a safe enough person to work with. And that also means being able to say when we actually can't consent to meeting the needs of somebody that is present because of our own stuff. So it requires a lot of self-awareness internally and also a lot of community care and community support and accountability to be able to hold all of us in the space where we're actually in alignment with the consent agreements that we're making to our clients and also to the field as a whole. So we're going to get a little bit more into like, what does this actually look like? So this is the kind of body of work that I steward. And then what I want to talk about next is where this comes from. So my work in developing this consent protocol is directly influenced from the kink and BDSM community and also from sex work worlds. So I am trained through a lineage called the Wheel of Consent, which was developed by Betty Martin. And we're going to go very briefly over that in a moment. But this is held through a lineage of sex workers. And so I've combined that with a lot of learning that I have from the kink community of how we handle consent in these really vulnerable states. So this Venn diagram here shows you, here are some of the overlaps of what we see show up in the kink and BDSM and sex work world that are very similar to what shows up in psychedelic facilitation. Number one is that there are power dynamics present. In kink and BDSM, in sex work, in psychedelic facilitation, there's an inherent power dynamic between the person facilitating and the person who is receiving. And we have to tend to that. There's the risk of the unknown, like I just talked about. In kink and BDSM and sex work, these are incredibly vulnerable states that we're going into. And there's a desire for some kind of transformational experience, just like Eddie discussed. And so there's a lot of unknown that we're stepping into this experience as one person with some hope that something is going to shift for us, or we will have an experience that impacts us in a certain way that changes something when we're walking out of it. Same thing in both of these worlds. Across all of these fields, there's a massive increase in vulnerability and suggestibility. And all of these include altered states of consciousness. So for decades, the kink community, the sex work community has been really grappling with how do we do consent when all of these things are present. And so us in the psychedelic field, I think that we have a lot to learn from these communities, and I have certainly looked to them as I've built this body of work and offer it to the field of how we can perhaps do consent in a more robust way in psychedelic facilitation work. So to talk a little bit about the Wheel of Consent, again, this is developed by Betty Martin, and I'm going to give like the briefest overview of this right now. And I really encourage you, if this is your jam or if this kind of sparks interest in you, there are hours of free content on Betty Martin's website. Please go watch her describe this. She's much better at it than I am. And there are workshops around this around the world. And it's a wonderful way to really deepen in your own consent practice internally and in your practice as a facilitator. So the invitation here is that how we work in terms of consent as a facilitator is based in our own relationship with consent internally. So I want to just invite everyone for a moment to kind of pause whatever you're doing, whether it's listening to me or doing something else too, and just ask yourself, what is your own relationship with consent? So that might be questions like, how easy or difficult is it for you to connect to your own yes and no, and then express it in relationship with someone else? What maybe gets in the way of that? How easy or difficult is it for you to respect other people's yes and no? And I particularly want you to notice if there's anything coming up of that there's a difference between how you respect other people's yeses and nos and how you respect your own yeses and nos. And so maybe just taking that question, doing whatever you'd like within the future, but I just want you to notice whatever's coming up, and that this is the reality for many people in our world, and especially in our culture, is that we have stuff around consent. We have stuff around yes and no. And from my perspective and the perspective of the teachers that I have sat with for many years, is that that is because we currently live in a compliance culture, not in a consent culture. And so many of us have been trained through trauma histories, through familial patterning, through society, through systems of oppression, and just how our world tends to work right now, especially in the globalized North and in the West, of that we're programmed to say yes. We're programmed that a no, for some people of certain socializations, could potentially be dangerous if we say no. We're trained to endure things that are uncomfortable and wait till it stops. And for many people and many families of origin, we're trained that if we say no, we're hurting someone else's feelings or that it means something bad. And for many of us, we're also trained that if we express a need and then it's not met and we get a no, something's wrong with us. We're too much, we're asking for too much, and there's a shame spiral that sometimes gets kicked in. So there's lots more dynamics around consent, but these are just some of the things that very often come up when you're doing this work and that I have worked with many clients around. So what I want to offer to you is that, if you're a facilitator or if you're seeking psychedelic services, is that all this stuff comes in the room with you. And as a facilitator, all of your stuff about consent comes in the room with you too. And so it's imperative that in order for us to offer that safe enough container around consent with our clients, especially if we're offering touch as a part of the psychedelic work, which is common, even, basic supportive touch like hand holding, we need to be deeply attuned to what our own relationship is with that consent and how we relate to our own yes and no, how we express it, and how we respect other people's yeses and nos. And then as facilitators, we also need to know how to assess our client's relationship with their own yes and no, and what is the potential risk of our client being in what's called the shadow side of allow in the wheel of consent, where they are enduring something that they don't want to have happen, and they could potentially be projecting us into what's called the shadow side of take, which is where we are perpetrating something. So in the wheel of consent, Betty Martin has really sectioned this off based on two questions. And question number one is who's doing the action? And question number two is who is it for? And there's two different dynamics. There's serve, accept, and take, allow. And with psychedelic work, facilitators should always be in serve, and clients should always be in accept. But things get shifty if they move towards the take allow dynamic, because a facilitator either starts doing something that is actually for them. An example might be someone feeling like, I've been sitting here for 4 hours, I'm bored, I want to help, I'm going to offer a guided meditation. We come back to that question of who is it for? That's actually for the practitioner, which means that they have shifted out of the serve quadrant where you are doing something that is for someone else, and you've shifted into the take quadrant where you are doing something that's for you. And that completely changes the consent dynamic that we set up and potentially sets up our client to be in a place of enduring, which can trigger massive trauma histories for people and sets up a potential for an ethical violation, either projected or real. Similar things can happen with touch. And so using this framework, we can apply this in our psychedelic work in preparation sessions and in administration integration sessions to really help facilitators orient around who is this for? How do I know what's going on here? And there's going to be some practices we're going to go over in a moment that help you build the relationship where the client knows what accept feels like. And there is some practice of how we have this dynamic of asking for what we want, having yeses and nos, and really building more of that trust that we can trust the yeses and nos that are coming out. So these couple questions, this is how we come up with an agreement, a consent agreement from the Wheel of Consent world. We ask what is happening. So we do that negotiation of what does one person want? What are the limits? How do we figure out a place where all those are met and everyone's consenting to it? Who's doing the action? Who is it for, which is the most important question. And I tell many of my students when I'm teaching this in a long format of that if you don't take anything from this whole multi-hour presentation, take this question, who is it for? And then if you are doing something in a psychedelic session and it's for you, that is a cue to stop and slow down and really notice what is coming up in yourself that you want to do this. There's the motivation towards it. And how can you pause and really ask, is this what should be happening if it's for me? How do I reorient to doing what is for the client based off of these attunement practices that we have and the understanding of this person's trauma history and my own hooks that could come up? And then we talk about how or when will it stop, which is basically saying, how do we know when we're done so that we don't, we aren't holding hands and one person decides, oh, I don't really want to do this anymore, but I don't know how to say no because we've all been programmed by society, yada, yada, yada. And try to move past that to have an agreement of we're going to know when we're done. When you say you're done, I say I'm done, or some kind of intuition comes up. So again, there's a lot more to go into this, but this is one framework that is incredibly helpful for facilitators to look through and also to help bring into prep sessions to help clients have a better sense of their own consent and work on that in building the consent container. So this is from Trauma Attuned Consent. This is a consent checklist. And I wrote a book chapter that is in the book Integral Psychedelic Therapy. It's edited by Genesee Herzberg and Jason Butler. My chapter is chapter 4, and all of these have detailed protocols for how to do this in session, what questions to ask, what to, step by step, how to do this, if anyone's interested in checking that out. I'm not going to go over all of these because we would not have time, but I want to just touch on a few of them. So the first one, so when we look at this, we talk about how in sessions we try to assess what is the client's baseline relationship to yes and no. The reason this is important and what I think about when I work with clients is that I need to be able to consent to feeling safe enough to go into this vulnerable state with the clients in the psychedelic work that I do. Both of our consent matters. I am not just a yes to everybody that comes my way. And there's many factors that go into that. And a big piece of it is, do I feel like I can trust my client enough that their yes and their no, when they express it to me, is honest and is in alignment with what's happening with them? If you remember from my bio, I specialize in working with people with complex PTSD. And so I work with a lot of people who have deep child abuse histories and that their relationship with consent has been, very messed up. And that as adults, that yes and that no get very convoluted because of the traumas that have happened throughout their life. And so this is a big piece of our work. And oftentimes I end up doing a lot more prep sessions with people to get people to the place where we both feel like we can trust the yes and no going into this. So you facilitators need to have a baseline for what do they need in order to feel safe enough. For me, my baseline is that I need my clients to be able to feel their body while they say yes or no to me. I just need to know they're not totally dissociated. And then from that point, we do a lot of questioning around like, what does an embodied no look like? We play some consent games, and I start building what I call a somatic map of what their body looks like through that attunement that we were talking about earlier, when they're actually in their body, when they are in alignment, and when potential trauma triggers are present. So if we jump to number 3, we already talked a bit about number 2. Jump to number 3. The invitation here is to do some trauma assessment and trigger points. And this is not like a big full-blown trauma therapist assessment, but really just asking what trauma might be in the room and how might that influence the container that we're in, and how might that influence the consent that somebody can or cannot give when they're under the influence of psychedelics. So we want to talk about, I ask people, what does your body look like when blank happens, blank being whatever the thing is they want to come in and work on. And so I start noticing, when do their shoulders turn in? When do they kind of have a stare like this? When can they not look at me and make eye contact? Do they start fidgeting? And so there's different things that our bodies will attune to that I can then use in session of noticing if that thing happens, there might be a trauma response coming up, and I need to be extra careful to make sure that I am attuning to the consent that we've talked about. And it also gives me a cue that I could maybe check in about something. So 4 and 5 here, we talk about hard and soft boundaries. If you're, working with touch, this is something that's incredibly important to go into with clients of, is touch a hard or a soft boundary? And what does that look like? What is on the table? If touch is a soft boundary, what can you practitioner's body offer? What does the client want? And then number 8, this is probably the most important part of this checklist, is practicing touch. I really believe that in order to have real consent, people's bodies need to have a sense of something before psychedelic medicine comes on board. So my clients need to know what it feels like for their body to be in contact with my body in the supportive touch way, if they've decided they want touch to be an option, before they ingest anything. Once we ingest something, we can't change consent. And so how can somebody say yes to having me hold their hand, or having a hand on the shoulder, or some of the, other things, heads holds, feet holds, like light body work with pressure? How can they say yes to that if they don't have an experience of it ahead of time? And what this also does is it creates that sense of safe enough of when we practice me offering, would you like me to hold your hand? And them saying no, and me just not respecting it, sitting back, and then asking, what do you notice? Their body now has an experience of me respecting their boundary. And that is typically increases trust in the relationship, both cognitively and also somatically in their whole system. So we go through all these different things, accepting, declining, them changing their mind. I do a lot of practice with folks around them requesting touch. My own personal boundaries is that I very rarely actually offer any touch in psychedelic sessions, and more empower the client to request what they want and start practicing for their needs to be met. And so we practice it ahead of time. And there's a lot of space to notice and ask what's coming up and do some of this process, which in and of itself ends up being therapeutic interventions for many people. And again, we want to be moving each step of the way towards that safe enough container to be able to do this risky thing and go into this massive unknown together. The last piece that I'll say here about the consent container is number 10. So when we are consenting to something, we need to be looking, let me back up. When we're facilitators leading someone through a consent process, we are attuned to what is their trauma history and how might it intersect with the work that we're doing. So if we are in the setting and the framework of psychedelic assisted therapy or research, or the regulated models like in Oregon or Colorado, we are in settings where there is not a built-in spiritual religious container. Many ceremonial practices do have that, where it's more of an opt-in of you are joining an ayahuasca circle and the ayahuasca is going to run that circle in their tradition. That's actually not how most of us are practicing in the regulated spaces in the US, and it's more co-created. So the clients have a lot more power. So what that means is that we need to empower them in that process to make decisions. And I always tell my clients, you get to be bossy in this process. You get to come in to the room, you get to look around. If you don't like anything in here, we're going to take it off the wall. Where do you want my chair? Do you want me by your feet? Do you want me by your head? Do you want me closer, further away? And then also thinking about the objects that are present, and additionally, the rituals that you might offer as a facilitator. There are many people in the facilitation practice where we have our own spiritual lineages, spiritual practices that we might want to offer. And what I would want to invite for facilitators that are listening, or just people who are considering this work, is that if you need your Buddha statue in the room, or if you need to smudge someone, or you need to offer a tarot reading, who is that for? I would argue that that's for you as the facilitator, that that's not actually for the client if you need it and you can't do your work without it. And so my offering in this body of work is that clients get to decide. They get to consent to rituals that are present. They get to consent to objects that are in the room. And particularly when we're working with people from specific trauma backgrounds like religious trauma, or people in queer communities who have gone through conversion therapy, these kind of things get even more important because of the massive overlap that we see between some religious trauma, cult trauma, and the way that conversion therapy works. There are many similarities with psychedelic therapy. And so it's our job, again, as facilitators, to be a safe enough person to work with and attuning to our clients and co-creating the space in a way that's going to support them to be able to do the transformational work that they're here to do. Okay, I will stop there.
But I actually wanted to, before turning to the audience Q&A, I wanted to ask a somewhat general question building off of this last point that you were making, Emma, around spiritual and religious use. And this is for everybody. I'm curious if the models of consent that you all are thinking about or practicing should be thought of differently when they are done in, say, a psychedelic church setting, or a setting that is not a biomedical therapeutic setting, but is rather explicitly religious and spiritual. Are there any differences to how consent operates in those spaces, or should operate? Are there any risks from applying a biomedical consent process to a religious and spiritual container? Any general thoughts about religious and spiritual psychedelic use and consent?
I'm happy to go first, if y'all are okay with that. So yeah, again, kind of what I was speaking about at the end is that I think that there is a difference in how consent moves and the level of co-creation of consent that's possible when we're in a research or a medicalized or a state-regulated model versus being in a ceremonial or spiritual space. I think about it more as like the ceremonial, spiritual, religious spaces tend to be more opt-in consent, and that this is the setup that is happening and somebody consents to being a part of that container. And again, consent is alive. You can revoke it at any time, so people can leave or not participate in certain things. But I think that the onus is on the facilitators to communicate really clearly. Here's what the circle is going to be like. Here's what the ceremony will be like. Do you consent to this? Knowing that that person doesn't have a lot of agency to change these different things. They may not participate in certain parts of the ritual, but they can't say, facilitator, I want you to not do this thing. Whereas in the settings, regulated models, research experience, et cetera, clients do have some more power to ask for certain things to be left out of that process. So I do think there's some differences, but I think that it's important that people are still empowered with the information. And I don't know that that's a total practice across the field, but I would really encourage it to be more aligned with high consent standards.
I think that in that setting, though, there is even more responsibility on the part of the responsible party, who's to know what's going on for them and to do what's best for the group or the individual that they're working with.
I really like, Emma, how you put that there. In terms of my own anxieties about the informed consent, I'm not so troubled about when this happens in a neo-shamanic or a spiritual context. Yeah, of course, as Emma says, like, these people coming into it need to be informed. Like, a good faith effort needs to be made so that they know what's going ahead. But I think it just fits more naturally with a spiritual context to like be invited to take a leap of faith in a way that doesn't sit so easily within the biomedical model.
Thank you all so much. I think this brings us to a great close to this conversation that's unfolded across the three of your presentations. And let's see here. We're grateful, of course, for the center's faculty director, Dr. Charles Stang, the center's executive director, Gosia Sklodowska, and our events coordinator, Lori Sedgwick, and the rest of the CSWR staff for their support. We're also grateful for the support of the broader Harvard study of psychedelics in society and culture. And as mentioned at the start, we have one more psychedelics-related event this semester. It'll be on December 10th at 5:30 p.m. online and in person in the CSWR Common Room. The event will feature visiting scholar Christine Hoskeller and an interdisciplinary group from her Decolonial Lens on Psychedelic Ethics workshop. The panel discussion will feature insights from this semester-long working group and imagine how this work can transform psychedelic studies, bioethics, medicine, religion, and more. And you can find registration for that event on the CSWR calendar on the 10th of December. And with that, we'll bid you all adieu for the evening. Thank you for your attention, for your thoughtful questions. Thank you, Emma, Eddie, and Kylea for your presence and your scholarship and your attention to consent. And we wish you all a lovely rest of your evening, afternoon, morning, wherever you are. Thanks so much.
Thanks, everyone.
Thank you.
Sponsor, Center for the Study of World Religions.
Copyright 2024, the President and Fellows of Harvard.